Good afternoon, everyone. My name is Hugh. Let me wait for my slides to come up. There we go. I'm the CEO of a company called RobinCare. In the parlance of the forum, what we do is care coordination and navigation. We think of it internally a little differently. We think of it as the cancer user experience. And we'll get interactive for just a moment to help me illustrate. How many people in the audience use Amazon because they choose to, as opposed to being forced to? Raise your hand. Just about everybody in the room. How many people use an EMR because they choose to, as opposed to being forced to? No one? That is the difference between thinking about the user experience and not thinking about the user experience when it comes to using technology. The reason we think about the user experience is that for patients, for caregivers, for clinicians, if no one's not thinking about your user experience, your technology will not service you. You will service the technology. We do this on behalf of employers and payers today, and we'll be working with clinicians soon. But let's talk about what we do. There are three things that make up what we do. First and foremost, it does start with a team of human beings. They're called the Robins. They are full-time cancer experts. They're on staff 24/7. They are everything from nurse practitioners to financial consultants, credentialed psychotherapists to benefits navigator. They're all hired and trained around empathy. And the reason is we've learned it's important to meet patients where they are. And where they are is not always the clinical issue. Most of our patients, when they initially present, they present around emotional and psychosocial needs. Often, they're logistical needs, often about financial toxicity, sometimes about the logistics of home. We've learned it's important to be able to take people and apply empathy and amplify human touch with technology. We've enabled every single one of our Robins with a set of predictive pathways. Now, these predictive pathways in simple parlance take the best practices for care, we turn that into a software framework. On top of that, we layer logistical and psychosocial dimensions. What that means is we are proactive about what's going on for every patient's case, whether it's symptom management, whether it's about transportation, whether it's about their own emotions or how they deal with their family at home. It enables us to be more proactive, but actually it also enables us to be more reactive effectively when we have to react to an unforeseen event. The last piece of what we do is digital platform. Now, we have a digital platform not because it's cool to have an app or a website or any of those things. We have a digital platform because what we've learned is people have liquid expectations about how things work in social media, online retail, even hospitality. And the fact that we don't deliver on those liquid expectations in healthcare becomes an incredible obstacle. So I can talk about what we do with our digital platform, but I thought it'd be more fun to actually let you experience it. So as I said, we're inspired by things like social media, LinkedIn, Facebook, et cetera. So this concept of a feed, the concept of the kind of interactions that you're looking for is important. And one of the things that we've learned, along with what everyone else has talked about, is the value of asynchronous communication. And chat has become an incredibly important part of our platform. A lot of patients on board with us this way, one of the first questions they frequently ask is, how are you going to work with my clinical team? Now, we work outside the clinical team, but we explain our positioning, which is we are next to and we are complementary to the clinical team. They're focused on your tumor, as they should be, and we're focused on everything that's going to happen to you because of your tumor, including things like symptom management, including working with the insurance company, including dealing with your own emotions. Now, if you fast forward a little bit, our patient, I call her Beth. She's got a chemotherapy appointment coming up. We're helping her keep track of that. We're also helping her keep track of some of the lifestyle things that she's going to need to be doing as she goes through her treatment. But we also know is that based on where she is in her journey, she should be thinking about staying at work as she goes to treatment. And we don't do this because it's good for employers. We do this because who you are at work is an incredible piece of who you are. That structure to your day, that social network is incredibly important to both your physical and mental health. And so we've simplified the questions that patients can work with that allow us to come up with an optimized plan for them to stay at work as they go through treatment. That combination of telecommute, adjusted work schedule, workplace environment changes. And on their behalf, we can execute that plan with their employer so they never have to figure out who to call, what to say, or how to explain it. And of course, for the employer, that has logistical advantages as well. Now, because we know that Beth wants to stay at work through treatment, we're changing up some of her content. As she's reading this article about staying productive as she goes through chemotherapy, Beth has some questions. Now, we always encourage people to ask their Robins, and they usually do. But in this case, Beth wants to ask one of her doctors. Now, with RobinCare, it's very easy to take a note. She can write down the questions she wants to ask. She can ask us to modify these questions. She can ask us to write the questions. What we've learned is asking the right questions, as you all know, is incredibly important to your own care. And this is one of the most important things that we can do. It's easy to attach that to an appointment. When she sees Dr. Johnson on Monday, it's easy to ask her on the day of the appointment. It's easy to call up the note with permission of the doctor. We'll even record the conversation, and that recording stays pinned to the questions. You have the questions and the recording in the same place. Now, as you all know, even if you have a recording, that conversation can still be confusing. It's full of clinical jargon, confusing terms, names you don't recognize. With RobinCare, you can swipe that recording to one of our Robins. We'll do a layperson's interpretation of that conversation, and we'll pin it right back to the note. So you have the questions, the recording, and the interpretation in the same place. This is valuable not just for the patients, it's incredibly valuable for caregivers. You can't believe the number of friends and family arguments this helps avoid by having common information about what happened at the appointment. Now, as you're going through the cancer journey, as you all know, you're experiencing things you've never experienced before. And the constant question is this normal? And this is where our health tracker comes in. This is built on the shoulders of the work that you've seen from the papers and studies you saw today, as well as other pieces of literature. This was actually started and based on ESAS. Now, there's some of these things that we pick, pain, nausea, fatigue, et cetera, that we're tracking based on what their chemotherapy, surgery, or radiation is. But we also let patients pick what they care about. And the reason is, part of the digital platform is inferring condition. So if Beth, our patient, was tracking anxiety, that was her choice. And she's tracking anxiety 10 times a day, but never touches pain or nausea. That's important because what it means is she's not experiencing pain or nausea to a point that it bothers her. And that's critically important. Everyone has a different threshold for pain or nausea. What's interesting is if Beth stops tracking anxiety suddenly and still doesn't touch pain or nausea, we actually know there's an acute event happening. A regular behavior has stopped. She doesn't have to change pain or nausea. We know to intervene. Now, in this case, Beth moved shortness of breath from a 1 to a 4, and clinically that's serious, and so we make a phone call. What's interesting is everything we do with our patients and caregivers is about avoiding these acute events from happening in the first place, by being upstream enough in the first place to avoid these, but also building the kind of relationship by helping you with the wig, by helping you with the insurance company, by helping you with the bills, that you'll ask us first if something is normal and pick up the phone if we need to make a phone call. It focuses on always being trusted, credible, always at the patient's side. This is an example of how technology enables a better relationship with the patient. Under the covers, we base this on the science around electronic patient-reported outcomes, around the clinical context of their situation. But it's a different way of using technology to engage, and it's a way that's focused on making it a good user experience so that they want to use it versus being forced to use it. Thank you.